We welcome our viewers around the world. Today's episode focuses on childhood stunting, one of the most powerful indicators of overall nutritional child health and national progress. Across much of the developing world, childhood undernutrition still claims countless young lives, standing as one of the greatest public health challenges of our time. We will explore what stunting really means, why it matters, and how 4 countries, Nigeria, Cameroon, Ghana, and the United States compare. Please, subscribe, like and share. For more information on global nutrition and efforts to end stunting, explore these trusted resources. The learning objectives are on your screen. In this video titled Africa's Future Begins with Nutrition, the Fight Against Stunting, we'll explore what stunting is, why it matters, and how countries are working to reduce it. We'll review global targets, compare progress across Nigeria, Ghana, and Cameroon, uncover the main causes, and highlight solutions and policies that can help every child reach their full potential. The World Health Organization established global child growth standards in April 2006, following the multi-center growth reference study conducted between 1997 and 2003 in 6 countries: Brazil, Ghana, India, Norway, Oman, and the United States. These standards describe normal growth patterns for all children, regardless of ethnicity, socioeconomic status, or feeding method, and replaced the older 1977 U.S. growth references. According to the World Health Organization standard, a child is considered stunted when their height is significantly below the expected level for their age, reflecting chronic undernutrition and poor early life conditions. According to the World Health Organization, stunting is defined as a height for age more than 2 standard deviations below the WHO Child Growth Standards median. In simpler terms, a stunted child is significantly shorter than expected for their age, not because of genetics, but due to chronic undernutrition, poverty, repeated infections, or lack of stimulation during early childhood. Stunting reflects long-term deprivation, especially in the first 2 years of life. This chart shows a child's length for age, one of the key measures used to detect stunting. The green line in the middle represents normal growth, while the red and black lines below indicate moderate and severe stunting. The blue curve with red circles shows a child's actual growth falling below the -2 and -3 standard deviation lines, meaning the child is significantly shorter than expected for their age, a clear sign of chronic undernutrition and stunting. Worldwide, stunting affects about 150 million children under age 5 years. This means about 20% or roughly 1 in 5 children are stunted. That's nearly the entire population of Bangladesh and Nigeria combined. While global rates have dropped from 40% in 1990 to about 22% in 2024, progress is uneven. Sadly, Sub-Saharan Africa still carries 1/3 of the global burden. Stunting is not just about height. It affects the brain, learning, and future productivity. Children who are stunted often perform worse in school, they have low self-esteem compared to their peers, earn less as adults, and are more likely to suffer from chronic diseases due to underlying malnutrition. In other words, stunting negatively impacts a nation's future. The causes of stunting are complex. It is the result of a cycle of poverty and deprivation. Children born into poor households often lack access to nutritious food, clean water, and health care. Low levels of parental education mean many parents have limited knowledge about proper feeding and child care. Poor maternal nutrition during pregnancy leads to babies born too small or undernourished. After birth, inadequate breastfeeding and poor complementary feeding practices deprive infants of the nutrients they need most. In many communities, unsanitary environments and frequent infections, such as diarrhea or malaria, further weaken a child's ability to grow. Together, these conditions trap millions of children in a cycle that limits not just their height, but their full potential. Across Africa, nearly 1 in 3 children under 5 suffers from stunted growth. That's about 64 million young lives affected by chronic undernutrition. Nigeria has the highest number of stunted children in Africa and the second highest in the world, with about 33% of children under 5, more than 11 million affected by stunting. India ranks first globally, where roughly 33% of children under 5, totaling over 41 million, are stunted. Cameroon has nearly 1 in 3 children under 5 affected by stunting, totaling about 1.4 million children across the country. In Ghana, about 17% of children under 5 are stunted, roughly 400,000 children nationwide. In contrast, the United States, though relatively low at approximately 3%, reminds us that stunting isn't limited to low-income countries. It also reflects inequality, poverty, and food insecurity, even in high-income settings. Now, let's take a closer look at the data to see what it reveals about stunting across countries. Nigeria remains a high-burden country for chronic undernutrition. It is among the worst-performing countries globally in terms of childhood stunting and undernutrition, both in prevalence and in the absolute number of children affected. In 2021, more than 11 million Nigerian children under the age of 5 were stunted, representing about 8% of the world's stunted children and over half of all stunted children in West Africa. Although the prevalence of stunting has declined modestly, from 42% in 2003 to 33% in 2021, progress has been slow and uneven. In Nigeria, a 2022 study by Dr. Oliteo Adeyemi and colleagues, published in the journal Food Security, found that the nation's stunting rate declined only modestly, from 42% in 2003 to 37% in 2018. In 2021, that figure had declined to approximately 33% based on data from the World Bank. Progress has been slow, though gains were linked to maternal education, household income, better sanitation, and expanded healthcare access. Yet, inequality, conflict, and regional disparities continue to hold back nationwide progress, leaving millions of Nigerian children chronically undernourished. In the study, Jigawa State, in the country's northwest zone, stunting rose from 53% in 2008 to 66% in 2016, the highest rate in Nigeria. By contrast, southern states recorded the lowest prevalence and achieved significant reductions during the same period. These sharp contrasts reveal that while Nigeria has made strides, the progress is uneven and far too slow. Turning to Ghana, a 2023 study by Danso and Opia, published in the journal Nutrition, examined children in Wanta South. The study found that 12.5% of children were stunted and 27.5% were wasted, showing that malnutrition remains a serious concern. Key contributing factors included parental unemployment, poor sanitation, short birth intervals, inadequate breastfeeding, and infections such as diarrhea. These findings highlight that, even as Ghana's national stunting rate continues to decline, local communities still face significant nutrition challenges that must not be overlooked. A 2020 study in Cameroon by Sombele et al. In the journal BMC Pediatrics reported a high burden of severe stunting and anemia among children under 3 years old. More than 30% were stunted, and many suffered moderate to severe anemia, showing the combined impact of malnutrition, infection, and conflict-related hardship. The authors warned that nutrition programs and peace-building efforts must go hand in hand to protect child health in crisis zones. The World Health Organization set a global target to reduce stunting by 40% by the year 2025, aiming to cut the number of affected children from 162 million in 2012 to below 100 million. The United Nations Sustainable Development Goal 2.2 goes even further, calling for an end to all forms of malnutrition by 2030. But today, more than 150 million children under 5 are still stunted, showing that the world is far off track and urgent action is needed. Let us now turn to our countries of focus, Nigeria, Ghana, and Cameroon, to see how each is performing against the global target set by the World Health Organization to reduce childhood stunting by 40% by 2025. We'll examine whether these nations are on course or off course, and what their progress reveals about the broader fight against undernutrition in West and Central Africa. Ghana is on course to meet the target for stunting, with about 17% of children under 5 years of age affected. Ghana's national commitment, via its development plan, is to further reduce stunting to 14% by 2025. Cameroon is on course to meet the global target for reducing childhood stunting. However, studies like that of Sambo and colleagues in conflict-affected Mount Cameroon remind us that regional disparities remain. While national progress is evident, some areas still face high rates of stunting, driven by poverty, poor nutrition, and ongoing instability. Nigeria is off course and will not meet the global reduction in reducing childhood stunting. While the country has made some progress towards achieving the target for stunting, but about 33% of children under 5 years of age are still affected, which is higher than the average for the Africa region, 30.7%. To end stunting, we must tackle its roots. First, by reducing poverty, so every family can afford nutritious food and clean water. Second, by investing in education and healthcare, ensuring mothers and children get the knowledge and care they need to grow strong and healthy. And third, by improving environmental health through clean water, sanitation, and safe living conditions that prevent infections. When these three pillars work together, economic opportunity, education, and a healthy environment, we give every child the chance to grow, learn, and thrive. Stunting is preventable, but only if nations act now. No child should be denied the chance to reach their full potential. We thank you for watching. The learning objectives have been met. We hope you enjoyed this video presentation. If you found this presentation informative and educational, please give this video a thumbs up and consider subscribing and sharing with family members, friends, and colleagues. Your support helps us create more informative and educational content. Until next time, stay strong, stay hopeful. This has been a presentation of Opomulero Media LLC.